Hi, I'm Yasmin, a wife and a proud new mom with a background in perinatal nursing. Welcome to Birth Unboxed, where we talk about all things birth, whether it's unassisted free birth, home birth with a midwife, or in a hospital. I believe every woman deserves the right to choose how and where she gives birth. I created this podcast to raise awareness so women can make informed choices and feel empowered in their births. By sharing stories and learning from one another, we can reclaim our power and become the ultimate authority in our own birthing experiences. Sisterhood is powerful, and I am so glad you're here. Let's get started. Hi, Susan. Thank you so much for joining me today on the Birth Unboxed podcast. How are you doing this morning?
I'm doing well. Thank you so much for inviting.
Thank you. So Susan and I met years ago. It's been years ago. I won't even tell you guys how, but now I have to. We met on a Miss Brazil Canada pageant. Isn't that right, Susan?
In 2011?
Oh, yeah, it was a very long time ago. So probably, yeah. But it was very lovely meeting Susan, and we've just reconnected recently. So I'm very excited to hear her birth stories because I don't know anything about your birth story. So I'm very excited about that. So give us a little introduction about you. You're obviously in Canada. Let us know how many kids you have.
Sure, yeah. So hi, everyone. I'm Susan. I'm a registered dietitian, and I'm a mom of two little girls. So one is 6 years old, and the other one is almost 2. So she's still 1. She's 22 months old.
Oh, that's lovely. So you have a couple of stories for us. So let us know how it was for you finding out for the very first time when you were pregnant. How was the pregnancy? Were you surprised? Were you expecting it? Were you scared? How did it go? And then when you got pregnant the second time, what was the difference now having had a baby already when you found out? Let us know a little bit about that.
Yeah, okay. So first time of my 6-year-old pregnancy, right? I planned. It was a planned pregnancy, so I really wanted to be a mom. I've always knew I wanted to be a mom. So I told my husband, let's start trying. So I'd say 1 to 2 years prior to trying to conceive, I started preparing my body, right? Like nutrition, environment, stress, everything. So, and then I would track my cycle. So when I got pregnant, it was like no surprise. I was just super excited, right? Like I was waiting for it. It was like a smooth pregnancy, very nice. Everything was like perfect. And I was happy. I was young. I was, I think, about 33 when I got pregnant, gave birth at 34. Okay. So it was pretty smooth. And then I had a second pregnancy, during pandemic, right? So it was 2021, but it didn't go as planned. It was a surprise. I wasn't expecting. I did not want to get pregnant during COVID, but it happened.
Yeah.
Long story short, that one, I lost the baby at 17 weeks.
Oh.
Yeah.
17.
Long story. Thank you. And
even
then,
when it's not planned, it's still very disappointing.
Yeah, especially that far along. But yes, but it was a good pregnancy too, nothing to complain, just nausea in the beginning, just like normal pregnancy. And then my third pregnancy, which is the baby that I have now, which is almost 2 years old, it wasn't planned. So I knew I wanted to start again, try again before I hit 40, because now I'm 40. But it was just after that loss, it was just very hard, right? Thinking of a baby, thinking of another pregnancy. Emotionally, it was very hard on me. But I told my husband, I really want to be a mom again, but before 40. It was just my goal, my personal goal. And then my husband was like, oh, yeah, we can try. So I started doing a lot of exams and blood work just to trust my body again. Because with that loss, lots of emotions came. And one of the emotions was why? like why, if I'm healthy, why I lost my baby, and then like is there something wrong with my body? So I started just, and then there was when I started my journey with fertility, because now I'm a fertility dietitian, pediatric dietitian, and exactly in 2021 it was when I started researching like why that happened to me, because my baby had a genetic problem. So I was just like, why did that happen? Why to me? Why that way? So my whys, you know, I had answers just by researching and specializing. So I started like, you know, my journey as like fertility pregnancy dietitian, and I got many answers, like, you know, and it was very nice. So I said, you know what, from now on I'm going to start helping others just to be the healthiest they can be, to become a mom, right? Not like trying not to let others go through what I went. And nutrition can really help you, right? So, and then after lots of exams, blood work, everything was fine. The only thing that wasn't fine, it was my reserves, my egg reserves. Like, I don't even know if they say reserves. Like, I don't know, the egg count.
Or your egg count. Your egg count.
So the egg count wasn't very good. So I kind of freaked out. I was like, you know what? But you know, we just need one egg. Just one good egg. Yeah. Right?
That's right.
So I was like, you know what? Let's just try. No pressure. Told my husband. And let's see where we get. So the third pregnancy was also a surprise because I knew my chances were pretty low, though I was like 37, which is not too old. But
no, although they do after 35, right? They're like geriatric pregnancy, and then that alone creates so much anxiety for us, right?
Exactly. But yeah, like deep down I knew like 37 is still very good age. Like, you know, I wasn't worried. But and then I found out, I was in shock because in my mind, of course I knew it could happen, but I knew my chances were really low. So when I found out, I was just like, what? Because of what I've gone through with my second pregnancy, I couldn't really say the word like I'm pregnant or get really excited because I was afraid. I was like, how about if I lose this baby? Like, should I get super excited? Should I tell everyone? So lots and lots of emotions. So I kept it to myself. I couldn't say, words couldn't come out of my mouth. You know, I was just like in shock. Like, of course, super happy, but like, oh my God, what do I do? I didn't even told my husband. I was pregnant, and it took me like the whole weekend, like Saturday and Sunday, to tell my husband because I was just like...
You just couldn't believe it, Yeah, it's a big deal, and it is very hard, and so many women do have losses. Like I also had a missed miscarriage for my first pregnancy, and we discovered it at 20 weeks. So getting pregnant the second time, it's also like, I want to be really happy, but what if it happens again? It's just like you're like protecting your heart, and also just like having to deal with people, because obviously no one like would be upset at you for having another miscarriage, and they would care and they would want to talk and be like, are you okay? I'm sorry this happened. But just having to relive that like daily, like when people are asking about it, it can be heavy. So a lot of time women are just like, I'm just gonna wait the 12 weeks or whatever to even start talking about it, just to have a better chance that this is gonna go through.
Exactly. So, and then the weekend passed. I found out it was a Friday, and then Sunday my husband was like, "Oh, you said your period was late. Like, how? Like, did you test, or like how was it?" And I was just like, and then I start crying, like, you're pregnant. And then I was like, yes, but I cannot talk about it right now. Like, you know, I need to take my time. I'm so excited, but I don't want to get too super excited. So it was like a
Yeah.
very tough pregnancy compared to my other ones
Right.
because of the
Yeah.
fear, right?
Yeah.
So, symptom wise, it was good, like just nausea in the beginning. But emotionally, I was a mess. And then I never announced like Instagram or like family sending pictures. I I just took my time, and then whoever would see me walking around with a belly, they would just be like, "Oh, you're pregnant," and I'm like, "Yes." But most people, like close friends and family, they knew, my past.
Yeah.
So I was just
Yeah.
like, you know what? I'm just taking my time and enjoying this pregnancy like one day at a time. And that was my third pregnancy, one day at a time, just trusting everything would be all right. And today I have a beautiful, baby, which is almost
Yeah.
2 years old. So yeah, this is like
Yeah.
summarizing a lot.
Yeah. No, but those things are very common, and it's good to share about those things because having had a miscarriage definitely impacts how you feel going forward with future pregnancies. And unfortunately, miscarriages are so common, and it's still not talked about enough. So a lot of time women do feel very alone, and they question like you did, like why me? Like what did I do wrong? Like I'm healthier, like why me? So when we talk about it, women, like after I had mine, I started talking about it, and so many women told me they also had miscarriages, and I realized, oh wow, like I didn't know these people that I know had miscarriages, and so many people came to me and told me about their stories, and then just made me feel a little less alone. Like, oh okay, like there's nothing wrong with me. It wasn't just me. This is very common. So I like bringing awareness to that as well.
Yeah,
So
and
thanks
not
for sharing. Yeah, go
and
ahead.
not only that, but like the emotional, like our emotional part, right? Which is totally a mess after, during, you go
Yeah.
back to work after you lost your baby, and then you're supposed to
Oh yeah.
smile, you're supposed to be yourself, and you're not. And for
Yeah.
me, like it's been 3 years now, almost, yeah, three and a half.
Yeah.
And still very sensitive topic, right? Because
Yeah, absolutely.
it will always be. So that's the point.
Yeah.
Like, and
Yeah.
like talking about like emotions and like how people can support us. I felt very alone in my workplace. Like people did not support me. It was just like it was just like very hard to deal with that.
Yeah.
I had to take vacation
Yeah.
days to do the
Yeah.
curettage. It was just like, I wish people could just support
Yeah.
way more
Yeah.
women who go
Yeah.
through miscarriages. You know,
Yeah. Yeah, because it does take a toll emotionally and physically. Like you said, you had to get the D&C, so you're bleeding for like sometimes a week or two after that, and like it's just a lot. And a lot of time people they don't know what to say. They like when it comes to death, a lot of time people or miscarriages because it's even like less talked about than when like an adult dies. People don't know what to say, so sometimes they just don't say anything at all, and they're just like uncomfortable, like I'm just not gonna bring it up, like but it is nice to acknowledge and talk to the woman, and there's nothing you can say that's gonna make it better, but just acknowledging it and just saying I'm sorry, no, I'm sorry that happened to you helps. A lot of time people like to say, oh, don't worry, you'll have another one, or oh, at least you have one child. I'm sure you heard that. And it's like that doesn't make it better. I know people are trying to say those things because they're trying to make you feel better, but those comments don't help. What do you think,
exactly.
Susan?
No, exactly. I think like the way, like thinking back the way I felt, I think like a simple, like I'm so sorry. It must be very hard. It's just validating. That's it, right? You
Yeah.
don't need to say anything else. Just like, oh my goodness, it is really hard. That's it. It
Yeah.
is hard.
That's
Just
it.
validate that
Yeah.
feeling and that's it. Move on,
Yeah.
right?
Yeah.
And then one thing that I liked from friends and family, like many people sent like notes and plants and flowers. I felt
Yeah.
so loved. So it was
Yeah.
very nice. Like for me, it was like,
Yeah.
oh my goodness, it was very touching. right?
Mm-hmm.
So
Yeah.
sending something like, like I'm thinking of you, like food,
Yeah.
flowers, self-care
Exactly.
kits. I got so many
Yes.
things that I was just like
Yeah. I love
overwhelmed
that.
by love.
Oh,
So,
that's
this is nice.
amazing.
Just send a
Yeah.
little thing like
A little something. Yeah.
I'm thinking of you and I know it's hard.
Yeah.
That's it.
Yeah.
Yeah.
Yeah. No, that's really great advice for people who do have friends or family who will at some point have a miscarriage to do something like that, because it makes such a difference. It just makes you feel hugged, and it makes it feel like that baby was real to other people as well. It just validates your feelings and all of that. So that's great. So you had your two pregnancies. The second one, clearly, it just felt heavier than the first. But how were the actual deliveries? So you're from Brazil, and I'm also from Brazil, but I moved here when I was very young. But I do know, and like my mom had a C-section. I know that in Brazil, the rate of C-section is very high. Last time I looked, it was something like 55%. So very high. And it's very normal and common to just schedule a C-section for no reason other than it's convenient for me, it's convenient for my doctor. Everybody does it. That's what we do. So coming from that culture and coming to Canada, I've heard from a lot of Brazilian women when they want to just schedule a C-section, because that's what they would have done in Brazil. Sometimes they get a little bit of pushback from their doctors, being like, but why? Why you don't need a C-section? And then they'll be like, but I want one. Like, why wouldn't I want one? I don't even know if you had a vaginal delivery or a C-section, but just coming from Brazil and then seeing how the system works in Canada could be a little bit different. How was that for you? What were your expectations? So tell us, go through the whole thing. Let us know how your deliveries were here in Canada.
Yeah, I'm going to summarize because as you can see, I can talk a lot. And I love talking about birth and kids and, all things about it. So, luckily I came here to Canada, when I was 23 years old. So I wasn't even thinking about birth or like becoming a mom, and I was coming, to a new country. So it wasn't really in my mind. But you're right. My mom had two C-sections. It's very common. Like I think nowadays they're thinking more about vaginal delivery, like, natural, blah, blah, blah. But like in the past, it was pretty much you schedule a day, you go there, you have C-section, that's it, right? But and then when I started wanting to become a mom, and with my science background, I started researching, right? Like, what should I do? What is your body supposed to do? So my research and watching documentaries led me to know that my body can do what it is supposed to do, right? So from the very beginning, I knew, like before even getting pregnant, I knew I would have a vaginal delivery. I would want, because one thing is your plan, the other thing is what
That's
happens.
right.
My plan was vaginal, unmedicated. That was what I wanted. So I got to my midwife because I wanted as natural as possible. And I told her, I want nothing. I don't like medications. I want to go natural, just like my grandma. Was I really scared? Yes. Past like 36, 37 weeks, I was scared. I told my midwife, I am scared. And she said, what? Like, we scared of what? And then I'm like, of the pain.
Yeah.
That was my only fear, like the pain I would feel.
Yeah.
But I kept reminding myself that my grandma delivered 11 kids. So
Yeah.
that was
Wow.
something that I was just,
Yeah.
holding on. I was just like, she did it. I can do it. So many
Yeah.
women
That's a
do
good
it.
way to think.
I
Yeah.
can do it, and she did it like back then. So we're going to do it now.
Yeah.
So, and
Yeah.
then my first one, like as I said, smooth pregnancy, everything good. And then she was born at 40 weeks plus 3 days. My water broke midnight. She was born 8 a.m. So it wasn't too
Okay.
long.
Yeah. Yeah.
So yeah, water broke. I was like, what do I do? Right? In one of the things the questions that I had is like, would I know if my water breaks? And then
Yeah.
some women would say like, oh, it was just like dripping. And then mine was like full
The full
water.
on
Like
thing.
my
Yeah.
husband had to mop the floor because it was just a lot of
So
water.
just like in the movies.
Exactly. So I'm like, this is my water breaking. And then I call midwife just to tell her, oh, my water broke. She's like, oh, good. Go relax, save your energy. I was like, no way I can save my energy. I was just anxious, right? Like, oh my goodness, oh my goodness.
Yes. Yeah.
So for this first pregnancy, I went from like water breaking, midnight, to like full blown like contractions in 1 hour. It was
Oh,
very
wow.
fast. So 1 hour later, I was already like in pain, like, you know.
Yeah.
So I think it was like 5 a.m. when I called the midwife, and I was like, it's hurting. It's like,
Yeah.
it's bad. I need you. Because like at this point,
Yeah.
I thought like my mom, like I had my mom, my dad, and my husband, they are not able to help me. I need something else. And then she was like, okay, meet me at the birth center in Toronto. So
Okay.
beautiful
Yeah.
place. She was born
Yes,
there.
I've heard a lot of great things about it. Yeah.
Amazing. So the whole family went. My mom, my dad, my husband,
Oh.
everybody. And they have a beautiful like waiting area. Beautiful place, you
Oh.
know. Um,
I love it. Yeah.
yeah, so my plan was to have a water delivery. And then I get there, they fill up the bathtub, and then there I go. But I started relaxing so much in the bathtub that my contractions spaced out.
Uh,
And then midwife was like, mm-mm, like we need you walking. So the last thing you want to do when you're in
yeah.
pain is like move and walk. But like there was
Yes.
no other
Yeah.
way. So I started
Yeah.
walking, and then contractions would just, be more intense. And then she measured, and then she was like, I think that's a goal, like 10 centimeters, let's go. And then she's like, where do you want to birth? Like, where do you want to go? And I was just like, I don't know. And then she was like, do you want to go like standing? Do you want to lay down on the bed? And I was just like, I don't know. And then she's like, oh, I have a birth bench or a birth stool,
Yeah.
which is pretty
Yeah.
much a stool with a hole like in the middle. And it felt right for me. Because one thing that I always
Yeah.
say, like, no matter what your plan, you're going to have to go with whatever you feel in that moment,
Yeah.
right? I never
Yeah.
even knew
Yeah.
about that stool. And
Yeah.
then I was like, oh, okay. So the lights were dimmed, right? Like very dark environment, very nice. So
Yeah.
every
Oh.
contraction, I would just squat and push, push, push. So I think 1 hour of like pushing, and then she came like direct to my chest, right? She started
Oh.
feeding.
Yeah.
It was great.
Oh.
So that was pretty much,
Yeah, that sounds
the whole,
beautiful. I
yeah.
love that your midwife was like, so which position? Where do you want to birth? How do you want to do this? Because coming from the hospital, I don't know if you know, but I'm a labor and delivery postpartum nurse. So coming from that environment, it's just like everybody births lying down. Everybody. Like, even if you don't have an epidural, like unless you're really saying like, oh no, I want to do it this way, it's kind of very standard and everybody just births lying down. So I love that. And it reminds me, my husband, before I went into labor, he would ask me like, so what is the exact plan? Which position are you actually going to push the baby out in? And I would be like, I don't know. I'm like, I want to have a water birth, but I'm like, but I may want to be standing I'm like, I need to see how my body feels. But he was like, but I want to know, like, I want to know what the plan is because I want to be ready for it. Like, I can't tell you that. There's no way to know.
Yeah, and it's funny, like comparing now, like two births. First one, I went with the flow. Like I didn't plan as much because I didn't know anything, right? Like I knew by the book, but not me, right? So the only thing that I told my husband is like keep me hydrated and just be patient. that was pretty much it. And he was very supportive, even though we didn't have a plan, And I even told him, like, he was like sitting on a bed behind me, and then I was just squat down, and he would hug me from behind. And every time when my contraction would come, I would tell midwife contraction, and then I would just push, and he was kind of pushing with me. And I told him afterwards, I was like, this really helped, because I felt like something else, right? Like not just me alone like, trying to push that baby out.
That's nice.
So it was pretty nice. So, and then I had snacks, I had Gatorade, water. And then the only thing that I told him, like, try to offer me, but I'm not sure how I'm going to react, right? So he just made sure he was like putting like some songs and offering me water and, so I was just like, try, let's see what's going to happen. And then after birth, I remember being hungry, like starving.
Yes.
So at the birth center, they had like toast and peanut butter and applesauce, like few foods. So I remember it was enough. But I can tell you what I ate after my second birth later.
Yes.
Yeah.
I want to hear that.
Anything else from my first birth that you want to know?
How was breastfeeding for your first baby?
First baby. Okay, she came out of my body already feeding. So midwife just told me like more or less what to do. When she cries, when she has her mouth wide open, just shove her here and then let's see. It worked. I think my nipples, this is one thing that I learned, the type of nipples you have, like it's going to impact your breastfeeding ability as well. So my nipples, I think, helped the shape of my boobs, her, mouth, everything. So for both babies, I had absolutely zero stress or concerns. They were just pro from the get-go. So they were always exclusively breastfed.
Exclusively breastfeeding. From birth until 1.5. My current baby still breastfeeds. So it was like no concern at all. For my first birth, I didn't have anybody helping me because it was like, it felt natural. But and then for my second baby, she would make some sounds, like clicking sounds with her tongue. So I consulted with a lactation consultant. She was very helpful. I really think it's a good idea for like, especially first time moms to have somebody to help them, for sure. Yeah. A lot of the time it's such a natural thing, but there is a specific way and a technique to make sure they have a really good latch. And from my personal experience, I knew what it's supposed to look like. Like part of my job in the hospital is helping moms get their babies on, and I know what to look for. And so when I had my baby, I knew. And she, again, as soon as she came out, she was already trying to feed. I was still on the operating table and she was already trying to feed. And she's a great feeder. But I struggled with pain for almost 8 weeks. And like my midwife, we all looked like the latch was perfect. She did not have a tongue tie. I just had, I guess, really sensitive nipples, and it just took weeks for them to, I guess, toughen up. But it was really hard for me, but we're still exclusively breastfeeding. But I love hearing it because so many people struggle so much. So it's really nice hearing from someone that like, no, it was fine. It worked. Like it didn't hurt. So that's good. So hopefully if you're listening, you're one of the lucky ones that it just works and it's a great fit and it doesn't hurt that much in the beginning.
Exactly. No, it was great. I had a little cream. I think it's called nipple butter. I got online. I would like in the beginning, first like couple of weeks, I would put it on. It's safe.
Okay.
It was pretty nice, but yes, like no major cuts or bleeding or pain. It was like natural.
Good.
And of course, even though like my first one was like easy, you know, she breastfed until like 1.5 years. you always worry, right, about your second one. It's a different time, it's a different baby, it's a different
Yeah.
body. And I was like,
Yeah.
will I be able to breastfeed again? But at the end of the day, it was also good. So yeah.
So when you saw the lactation specialist, was there anything different that you had to do with your second one?
No, she was just like pretty much like checking position and latching and then checking for tongue ties because of the clicking sound. It was virtual,
Yeah.
but it was very helpful, like just knowing more about like what's appropriate, rather than just you doing whatever you
Yeah.
think.
Yeah.
And the only thing also that made me more confident, because in the beginning with my first daughter, I was always like breastfeeding, like sitting down like this, right? Even like
Yeah.
throughout the night. And then
Yeah.
for the second one, of course, because I'm like way more tired now because it's my second baby and I have like
Yeah.
another kid to deal with. I was
Yeah.
breastfeeding way more like laying down.
The sideline.
Yes,
Yeah.
yes. So where I could rest way more. So I think that's one of the reasons I could extend breastfeeding, because it wasn't a burden, right? I was just kind of like
Yes.
with
Yeah.
her. So I didn't do that with my first one. I don't know why, but for the second one, it worked, and it worked really well.
Yeah.
And I felt way more
Yeah.
rested in the morning. So
Yes.
yeah.
Yeah. I had a mom who has a baby a few months older than mine ask me, like, have you already started like feeding lying down? And I'm like, no, like she's too little. I don't know like if I'll be able to like actually get her on the breast. But then I think maybe when she was like 2 months I started that, and it's been a game changer. So overnight we only feed lying down. I don't sit up anymore, and it's so comfortable, and we get to do it like much longer, and game changer. You definitely get to rest more. So
Yeah, right?
recommend that.
Yeah. I always say it's not a cookie cutter. You have to see what works,
Yeah.
what doesn't work. I think it's just like your birth plan. Like you have a plan, you have a will or wish, but will that work for you? We don't know, right? We have to try.
Exactly. Yep. Exactly. And just one quick thing. What I noticed a lot of time in the hospital, if you already had a child, when you go feed that second baby, you're used to holding your older child in a specific way, and you try doing that with the newborn, but it can be a little hard sometimes because you really want to hold your head, so it's a different position in the beginning. So that sometimes is something that parents struggle when it's their second baby, being like, why is this not working the way it works with my like toddler?
Exactly.
So
yeah.
But yeah, let us know about the second delivery. How did that go?
Yeah. So the second one, she was also born at 40 weeks and 5 days, almost 41 weeks. I was freaking out because all I knew was like, this baby needs to come out because I don't want to be induced. That was one of my things. Few things that I had in mind. I didn't want any like tools or anything like suction to suck the baby out of me. And then this time around, because I was older too, I told we had a better plan between my husband and I. I had a pelvic floor physiotherapist, which helped me to kind of like design a plan, like based on what I wanted, what she like felt with my cervix and, my pelvic floor. I remember like at the end, she was like, you know what, you're pretty soft. Like she helped me a lot with like kind of relaxing the pelvic floor for birth. It was pretty nice. I highly recommend a pelvic floor physiotherapist. So we had a plan between my husband and I. I told him like, you know what, if there's anything like any tools or anything to be used, help me advocate because I want a C-section. Just, open me up and get this baby out of me. But again, I told my midwife, like I want unmedicated. as natural as possible. But this time around, because I had moved out of Toronto, I had to deliver even with midwife in the hospital. So
Okay. Yeah.
I was like fine with it because I've heard things about the hospital ward that was like pretty nice, you know, all good. So I was like, I have a midwife, which is okay. So it doesn't matter where I'm delivering. All that matters is that I have a midwife. That's what I wanted, right?
Yeah. Yeah.
So, almost 41 weeks, water breaks this time, but dripping in the morning. And then one thing, just going back to whoever never experienced that, even dripping, you know it's your water. You know you're not peeing, because I hear that so many times. Like, how would I know if I'm like peeing or if the water breaking?
Yeah.
You're going to notice. You know, dip down in your body, you know you're not peeing. It's pretty much your water breaking. So it was dripping. I was like, fine. Took my daughter to school. Was fine. Put a pad on. And then it started dripping a little harder. And then I was like, oh, okay. I think, you know, it was like 8 a.m. Baby's going to come today. I was like, baby's going to come today. And then contractions, differently from my first birth, it started very mild. And then I was like, ooh, that's easy compared to my first one, which came like full on. I was like, that's
full
easy.
On, yeah.
Yeah, so I was able to have lunch, you know, just take my time. And then it started being a little bit more intense, very slowly, progressed really slowly. And then by 5 o'clock, I was like, ugh, like in pain. But I remember the pain. I think because I already knew the pain wasn't that bad as my first one. I was, I think, more ready, or like I knew already what would happen, right?
Yeah.
So the pain was pretty much coming from the bottom of my belly to like towards my cervix. So I knew like cervix was like opening up, right?
Yeah.
More and more. But this lower pain was like very hard, where I could not walk. If like I had a contraction, I would have to sit down. But I was thinking like, you know what? I can do it. It's, you know, it's not as bad as the first time. And I was pretty confident. And it went through my head just to call midwives to my house. Like, you know, let's just have a home birth. And even my friend, this time around, I had a friend coming. So she brought me smoothies, you know, like she was just here, like helping with pressuring like my back. My husband was working. That's why. She was here. My mom was here. My dad was here. So I was kind of like, okay, I got this. And then she's like, how about we call the midwife? They come here. And I'm like, you know what? No, too much work. I'm going to have to set up the space. I have a dog here. The dog's going to bark at a midwife. Like, no, let's just go to the hospital. The hospital is like 20 kilometers from here. So not too close, not too far. Good. And then 5 o'clock, it was like already like a lot of pain. So I call midwife and I say, I know I have a very good tolerance, like pain tolerance. I think we should go to the hospital, because she wanted to keep me here for a little bit more, for contractions to start a little bit more often. And I was like, no, let's meet at the hospital. She was like, oh, okay. So how about in an hour we go to the hospital? I was like, fine. So we all go, my friend, my husband, and me. And my friend, mind you, she has 4 kids. So she has already birthed 4 times. In many different ways. So I was like, she's the perfect person to help me, right? This is actually a very good tip. If you have a friend who has birthed already, I think this friend could join you, because they know, right? They know.
Totally.
So it was nice. So we got to the hospital. I think I was already 7 centimeters, like dilated. I was like, ooh, I got this, right? Like, it's almost time. Let's wait a little bit more. But my water, remember that I told you, was just dripping. Midwife checks, blah, blah, blah. We wait a little bit. Things are not progressing as fast. And then midwife offers to break the rest of my water to speed up process. And the only thing, like, I never thought about it. Like, should I break the water? Like, what do I do? So she says, if I break your water, things are going to go very fast from here. And then I'm thinking, should I do this, which is not as natural, but I'm going to be over with, right? Or should I just wait here, I don't know how many more hours until things start progressing? So I was just already, like, in a lot of pain. I was like, you know what? Let's just break that water. She's like, easy, 2 seconds. And it was easy, 2 seconds. I felt nothing. Lots of water came, and then things really started. I would say from breaking the water and then delivery, it was like pretty much an hour.
Oh, wow, yeah.
So things progressed really, really fast. So I was walking the whole time, moving my body too. I was squatting. I'm pretty sure you do that a lot in the hospital, squatting over the toilet.
Sometimes. I use the birthing ball a lot as well. But in the hospital, most people end up getting an epidural pretty early on, if I'm being honest, and then you're lying down in bed.
Okay.
So in the beginning, they're moving around, but that's not for very long.
Yeah, so I was doing a lot of squats, like holding the toilet, like the upper part, like, you know what I'm talking about, right?
Yeah.
I was just like, I'm ready. Like squatting, it was like, bring my baby. And then I remember telling, and I remember from researching, they say when you think you're not going to be able to bear it anymore, it's just because baby's there, it's just so close. And if you feel like you're going to poo, it's like baby coming, right? Because many people, what I hear from friends in like birth stories is many people think like, oh my God, it's so painful. That's it. I'm not going to be able to do it. Just give me epidural. But the reality is, like, if you've gone like this far, baby's going to come in 2 seconds. Just wait a little bit more. So I remember just telling midwife, you know what? I really feel like she's coming. I'm going to poop right here. And I knew it wasn't poop, right? It was just like baby pushing everything.
The pressure,
Yeah, and then she's like, you know what? Let's go to bed. Because it was like a small hospital room, so we didn't have so many options, like the birth center. So one thing that I had researched is that I wouldn't want to lay down completely. I would want to be like on my side, so you know, bones can move a little bit better for baby to pass. So I go over to my side like this, and then my husband like holding one leg, my friend like supporting me and recording the birth, right, with my cell phone. And then I would say it was pretty much like 10 minutes, like pushing compared to 1 hour with my previous baby. It was like 10 minutes. That's pretty much the video that I have, like pushing, 10 minutes. I was like surprised. Amazing. She came really fast. The pain was like very hard, like the passing, right?
Yeah,
very like
the ring of fire.
Yes, exactly. But I knew I could do it because I've done once. And then what really helped me, it was just like focusing on one point. Like, I don't know, it could be like the curtain, you know, the light. But just like when she said like, it's now. And then I was just focusing in one point and just like giving everything. In front of me. And then she came. And then again, she came straight to she was healthy, right? So she came straight to my chest. We had a delayed cord clamp, right?
Clamping,
which helps with iron stores. Not sure if many people know that, but do your research.
How long were you able to do it?
3 minutes.
Okay.
Yeah, it was pretty nice. We took our time.
Yeah.
So recommended it's at least 1 minute, right? So we did 3 minutes, which
Yeah.
increases baby's iron
Yeah.
source a lot.
Yeah. Yeah.
So I was so happy because we never know. This is what I wanted, but if
Absolutely.
we're going to be able to
Yeah.
do it, we don't know because it depends on baby's health, right?
Yeah.
So we were able to do 3 minutes. She latched like immediately, it was just like perfect, just like my first one. However, first one, placenta came naturally, like after like one injection of oxytocin. That's it.
Uh-huh. This was in the birth center
The birth center, yes.
the first time.
And then the hospital one, placenta wasn't coming out. And then I just feel like they're getting worried. And I'm like, what's happening? And then she's like, Susan, can I give you another oxytocin injection? And I'm like, of course. Like, just give me anything to make this placenta out of me.
Yeah.
And then they're like, and I see their faces, like, placenta is not coming. And then I'm like, how about now? What do I do? And I remember I started feeling a little bit dizzy. I was having blood loss, right? So, and then I'm like, kind of like wanting to sleep. And then I see some movement called the OB, and then I'm like, what is happening? And the midwife, very sweet and calm, she was like, Susan, your placenta is not coming. It's been already 30 minutes. We're not going to wait anymore because you're losing blood. We have to call the OB and take this placenta out of you. And then I was like, oh, okay. But and then I was already getting like very, very weak. And then I had my baby on my chest, and I remember just saying, someone else hold that baby because I'm weak. I didn't have arm strength, right? So my husband kept the baby for the whole time, and my friend as well. And then I start seeing, like, I had 2 midwives in the room, and then 2 nurses poking me because I had nothing on me, like no wires, nothing. But and then
yes.
Yeah, go ahead.
They
Sorry.
put an IV. They put an IV when they came in.
Yeah, so she started looking for my veins, and I remember nurse was already like, I'm so sorry, I'm poking you so many times because I cannot find your veins. So she poked me like a lot of times. She was like, I'm so sorry, I'm so sorry. I'm like, you know what, don't be sorry, just do your job, it's fine, you know?
Yeah.
And then I start seeing the rush, and I remember asking the midwife, am I going to be okay? Because you're dizzy or weak, you were like overwhelmed, right? Tired. And then she's like, yes, you're going to be all right. We're just waiting for OB to come, but you're going to be fine. But and then you see the rush in the room. Like, you see something is not right, right?
Oh, yeah. Yeah.
And then they finally found my vein, started whatever they started there, right, in my vein, medication. I don't know what was that. And then OB comes. She's like our age, I would say. And she comes, and that's why I say, like, you know, your behavior changes everything, right? So I was already tense and worried, and, you know, and she comes, and she's like, hello, Susan, like, super excited. So I'm like, if she's super excited, I don't think that's like a real emergency, like I'm dying here. And then she had a student, a male student, and then she was like, oh, I have so-and-so here. Is that okay if he watches the procedure? And I was like, yeah. And then she's like, Susan, I'm going to insert my hands inside you, and I'm going to take this placenta out of you. And I'm like, of course. Like, that's okay. I was just agreeing with everything. Just, you know, just let's get this over. And then midwife was like, Susan, she comes like to my side, very sweet, and she's like, it's going to hurt a lot. Do you want some gas, like the laughing gas, right? I don't know how the technical name for this is.
Yeah, laughing gas, nitrous oxide. Yeah.
Exactly. So I was like, yes, because I had the laughing gas for my first birth, like available to me all the time. For this one, I didn't, but I didn't ask either. And then this time, she's like, do you want to have a little bit of gas? And I was like, yes. So one thing that I felt was really nice because I inhaled the gas and then they wait for like a couple seconds and she's like, "Are you feeling funny?" And I was like, "No." And she's like, "Let's do it again because you have to feel funny." Like almost dizzy, drunk, right?
Like a little high.
Exactly. So I'm like, "No, I don't feel that way." And then she's like, "Do this way, that way." She guides myself like how to do it, like inhale, and then I do like a really good inhale. She's like, "Are you feeling funny?" And I'm like, "Oh yeah." And then I definitely felt it. And she's like, "Okay, now I'm gonna do it." And then I'm not sure if it was the gas or like everything that had already happened, right? Like birthing and everything. I don't remember feeling any pain from the placenta removal.
Yeah, that's good.
Yeah, I just remember like she was like, "Oh, good. I removed everything. You're fine." But I was worried, like really worried. And then I asked OB, "Am I going to be okay?" And she's like, "Yes, you lost a lot of blood. If you lose a little bit more, we're going to start like a transfusion. But I don't think you need it right now. Just rest. You're going to be fine." But I was scared to death. I'm going to tell you.
Yeah.
I was super scared. And then that was it for like birth. It was like very easy. However, I had this retained placenta, which up to this date, I question myself. Like, could I known that my placenta was like retained, or like could I do anything else differently? But I don't think there is anything like ultrasound. Like, why?
No. Did they ask you at any point like to cough or like push a little bit after the baby was born, or was she just trying to just pull it on her own?
Yeah, I remember like kind of like doing a little bit of like pushing to try to push the placenta out. Yeah.
Okay.
Yeah. So, and then I kind of like started feeling a little bit better. So one of the nurses, midwives are gone at this point. One of the nurses, she was like, "You have to get up, like try to pee, and I remember like same procedure with my first. However, with my first, I stood up, I go to the washroom, I sit down on the toilet, and I remember like kind of like passing out. If it wasn't my mom with my first, if it wasn't my mom to scream, because my mom was like, "Help!" And then I kind of like woke up again, and then midwife came. And then this time around, I sit on my bed, I try to get up, I pass out. I was really scared.
Yeah.
And then nurses were like, "We're not gonna be able to." So I passed out 2 times. Okay, we tried 2 times. Nurses are like, "You're not gonna be able to stand up. Let's start a catheter for urine." Is that how it's called?
Yeah. A urinary catheter. Yeah.
It hurts.
Yeah.
I hated it. It hurts. I couldn't like move in bed because I had to stay over in the hospital. Because if it was like a normal, beautiful birth, I would be home like in 3 hours.
Yeah.
Right?
Yeah.
So I had to stay until the morning. So I had the catheter. I couldn't move. I couldn't go anywhere. I was just like, oh my goodness. So I stayed overnight, and I remember it was like, I don't know, late, 3 a.m., 4 a.m., I don't remember. I couldn't fall asleep. I was scared. And then I remember calling the nurse, and then I'm like, "Is everything all right with me?" And she was like, "Yes, just try to rest." And I'm like, I am so scared. Like, if I sleep, I'm going to die or pass out or whatever. Like, are you sure I'm okay? And she's like, "All your signs are good. You're good. You just lost a lot of blood. Just try to rest." And I'm like, if anything happens, we will come. We will get notified. like, my vitals, whatever. She's like,
Yeah.
yes, yes.
Yeah.
Just, I was scared. I was scared.
Yeah.
And then I was like sleeping, but just like, when you sleep and then you wake up and then I couldn't
Yeah.
rest. I couldn't rest.
Well, even when it's like a natural delivery, all that adrenaline, like it is very hard to sleep after.
Yeah. So, and then morning comes, they do another blood work. They're like, oh, you're good to go. Go home. And then I started like supplementing, eating really well, like lots of iron-rich foods.
Yeah.
And then I was very weak. So postpartum, comparing to my first one, I was pretty much in bed for a week.
Yeah.
Not like I couldn't move. I didn't have energy.
Yeah.
I was shaking. If I took a shower, I would just shake, 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 shake.
Yeah.
So and then it took me a week to feel like, okay, I can walk slowly, I can take a shower. It was very tough that week after.
Yeah.
It was very tough.
Yeah. That's we were talking about nutrition, like that iron component makes such a huge difference, not only throughout your pregnancy and for your baby, but that postpartum, when you're low on iron, like it just makes it that much harder for your recovery and your energy, and you're already not sleeping because you have a newborn. So it's crucial. Like I didn't eat red meat for 8 years, and during my pregnancy my iron just kept dropping, so I started eating red meat again because I was like, my body needs this right now. And it made such a huge difference. And then having had a C-section and my recovery was so hard physically, I'm so glad that I was just like, I'm gonna take this seriously, because I had heard how much harder it is when your iron's low. And you had the comparison from the 2 pregnancies where the second time after losing all that blood, it's like immediate, you really notice it.
Exactly.
Yeah.
So one thing that I always say, prepare like before baby, right? Like your third trimester, prepare your foods, freeze it, like lentils, beans, red meat,
Yes.
eggs, oats, be prepared. If you don't have like a support system, I was lucky to have everybody here, right? Like my mom and my dad and husband.
Yeah.
So she could cook for me. But if you don't, I always say plan your meals, like iron-rich meals, because even if you don't have a blood loss, you need iron. You need iron after birth, right?
Yeah.
So you need to eat well. So I always say, go see a dietitian during pregnancy, and especially like for meal planning before baby, right? Like before baby comes, just get ready. Your freezer ready.
Be ready.
Yeah.
Exactly.
So, and then from that week, like after just being in bed for a week, and then I started feeling much better. And then things started improving, and then I could see my body healing pretty much, could feel it. And then things started getting better and better. But it was like a good birth, but and then just one
a little
hiccup.
scary.
Yeah.
Yeah.
But I think like from what I researched, it happens. And I was lucky to, be fine and healthy after. And then one thing that I also had with my husband was just like a few things that I planned with him, which I didn't have in my first one. Oh my God, like not a secret word, like just a password. To sign on to him, like if I didn't want to do that anymore. Because I was worried, like, because I told the midwife, like, I want natural medicated, they would push for that. But and then I told him, like, we're going to have this secret word. Like, I think it was like pineapple or something. If I tell you this means I am done. Like, just do whatever. Like, just give me medication. Just put me on the table and do a C-section. If I tell you this word, you're going to advocate for me to not do, like, to not push anymore, But luckily I didn't need to use that word. But it was one thing that I told him, like, if I tell you this, this is serious. And he was like, okay.
That's good advice. But it's so important to really talk to your support person before you go into labor. so that they really know what your preferences are. Because when you are in that labor space, you kind of forget everything, and you just, like, I couldn't talk. My contractions were coupling so much, I just couldn't talk anymore. So if my husband and my mom didn't know what I wanted, then you're left to like the midwives or the OB being like, this is what we're gonna do. And if they don't know, they'll be like, okay, sure, yeah, go ahead. Like, she's not saying anything. So it's really important to do that whole piece beforehand. That way you can ensure someone's there advocating for you when you're not able to advocate for yourself.
Exactly. Yeah. So that's really important. And take notes for a husband, because they can forget, right? So that's what I did.
Yes.
I'm like, I took notes.
Yeah,
like,
my husband asked me to write it out.
Yeah.
Yeah.
And then I have to tell you, in the hospital, there was like no cafeteria or anything. And I wasn't ready to stay overnight. Because in my mind, I was like, that's going to be easy.
You were going to go home.
I'm going to go home. I have dinner there, whatever. And then around the hospital, it's like a small town that we live now. There's not a lot of things. I was starving. Like,
yeah.
I think, I don't know if it was the same for you, but both of my births, I was just starving.
Yeah.
And then my husband like Googles like around, and he's like, there's nothing open, because it was nighttime. He's like, the only thing that's open is like a McDonald's. And I'm like, you know what? Let's get those calories.
Yeah.
So that's what I ate, the number one combo after birthing. I'm like, that's so funny, like, coming from a dietitian.
That McDonald's probably never tasted so good.
Exactly, yeah.
Right?
Oh,
yeah, no,
and then
I was starving too.
Yeah, you too, right? Yeah.
It's
crazy.
Insane. Yeah.
It's a lot of calories. Oh my goodness. It's like that you spend, right?
It's a marathon.
Yeah. And then
really
the other part, just getting those moms like ready for anything that I didn't have with my first daughter, though my first daughter had jaundice. She didn't need the light treatment.
Yeah, the phototherapy lights, yeah.
So for the second one, midwife comes and she's like, oh, her bilirubin is kind of high, but like, let's just check. And then she comes on day 2 and she checks again. It's not going down, even though like she's feeding well, like breastfeeding well. And then she comes day 3 and she's like, Susan, you know what? Go to the hospital. She was just like that. And I was scared to death too, like again, because I'm like, what? She's like, drop everything and go to the hospital right now with your daughter. She's like, I'm going to get everything ready for you at the hospital. But remember that I told you I was like 7 days in bed. So imagine me getting up with my baby and going to the hospital, like driving, getting on and off the car. It was a nightmare. I'm going to tell you.
Yeah, I can imagine.
And then I'm crying because I'm like, I don't want to do this, but I have to.
Of course.
Nobody can do that for me because baby's feeding like on my boobs like every hour. So my dad takes me to the hospital, and then there she goes like under the lights. And then hospital wants to start formula. Because I think first thing they assume is like baby's not getting enough.
Baby's not feeding,
So not feeding, bilirubin is just like getting there, right? She's not excreting. And I was sure baby was getting enough. Like I knew, right? And then nurses come. Luckily, the nurses were like very nice. They come already with like 6-pack of like little ready to feed formula.
Wow.
And then I'm like, I am not giving this to my baby. And she's like, oh, let's assess your boobs, right? And then she sees that I have a lot of milk, like a lot. Day 3, I already have a lot of milk. She's like, oh, no, I'm pretty sure you have a lot of milk. So you don't need to give formula to your baby. I'm like, thank God. So I don't need to give formula to my baby. And then she goes under the lights for 24 hours. But and then that's the point where I think we, even though we are weak and tired and overwhelmed, we need to tell people our needs. Because I'm going to tell you like quickly, because I know we already extended, the conversation. But I just want to empower the moms like listening to communicate. Because we're so vulnerable, right? When we're just there and weak and had a blood loss.
Absolutely.
So babies in the I don't know the name, the little thing that babies
The
go under the light.
Yeah, the incubator.
Incubator, yes. So she's there, and I'm like lying down in bed and watching Netflix. But I have to get up all the time, and I'm weak, right? And then I'm like, this is not working. And then one of the nurses come, and I'm like crying. I was crying. And I'm like, I'm
Oh,
tired. I don't want to get up. And she needs to be under the lights. And I have to get up every hour. And I'm like, I don't know what to do. I was alone. And because they did not allow my husband to stay there with me.
yeah, just one person,
Just
right?
one person.
Yeah,
And I was
yeah.
I was scared. I was overwhelmed.
It's
And
awful.
it's
Yeah,
awful. And then I was like, that's why my dad took me there. Because I was like, what's the
yeah,
point? Like, let my husband just do his things, like take care of my older daughter and stuff.
yeah,
And then I go, my dad dropped me off there. And then I started crying. I was like losing
yeah,
it. I was losing it.
yeah.
Like,
And it's also like the baby blues. It's around like day 4 usually when that starts happening, when your milk really comes in. You're exhausted. You're been separated from your husband and your other daughter. It's just horrible combination.
yeah. And then the nurse, like one nurse comes and I start crying, like for her. And I'm just like, you know what? I cannot do it. I told her. I was like, I need my husband here. First off, I need my husband here. Second, I cannot get up from this bed. I'm exhausted. And then she comes with a blanket, and the blanket was like the light therapy. I was like, that's
Yeah.
genius. I could hold my baby 24 hours or my husband, and she would still be like receiving that light. I was like,
Yes. Yeah.
whoo, thank God, you know? It was like life changing.
Yeah.
And I didn't know. Nobody
Yeah.
offered me that blanket.
Yeah, yeah. So the hospitals, like, their policy keeps changing depending on what the new evidence shows. So that's supposed to be what they do now, the blanket. But then sometimes, depending how high the bilirubin is, they will put the baby with the blanket and they still need the overhead lights, like they need max lights. But ideally, the blanket should be enough for the majority of babies. And I feel like some hospitals are just starting to get into that now. But it changes everything because your baby hates being separated and alone from you. And this way, you can feed your baby, you can hold your baby. It just makes a huge difference.
Exactly. And then just to finish up that little story, it was my wedding anniversary that day.
Yeah.
And I was just like,
Oh.
oh my God, it's my wedding anniversary. I'm here in the hospital. I'm overwhelmed and tired and weak. And then I finally got like nurses to tell me that my husband could come. So I call my husband and
No.
I say, you know what? You can stay here overnight with me. Just come. And he comes with like flowers and dinner and balloons. And I was just
No.
like when I saw him, I was just
Oh.
like, "Ah."
Bawling.
He was so
That's so
special.
sweet.
Yeah,
Yes, that
yeah,
is so special.
yeah.
Oh,
And I
I'm glad
felt
he did
like
that.
now I'm complete. I have my husband, my
Now
baby's here.
everything's
We're
okay.
gonna go back
Yes.
like home in the morning. So that was the last like piece
Yeah.
of my birth story, pretty much.
Yeah.
Yeah,
Yeah. Oh, I'm glad you advocated for yourself. That's so important. A lot of the times women feel, or just families in general, feel like they can't ask or say anything. Like the doctors and nurses will tell them like, this is what we're doing, this is what it's going to be. And they just feel like, okay, like, no, it's still your baby. You can still say things like, no, I don't consent to this, or I want more information. Why? Or is there an alternative? And in like your case, you were so fresh postpartum, and like, I need someone here. Like, I am not okay. I need someone. And a lot of the time, they'll be like, okay, we'll make an exception for you. So sometimes you just have to advocate and just talk to your support person and have them advocate with you and just talk. Don't just sit there and accept and feel like you have no options. There's nothing you can do. And this is also for you to consider during the actual birth. Like, you have choices for everything. It's not always put out that way. It's just like, hey, we're going to do this now. but you have to consent. You can say no, or wait, what is that? What is in that needle? Like, you can ask, you can say no. Don't be scared. Learn to advocate for yourself in the hospital system. It's so important. You really need to regain that power. It is your birth, it is your baby, and you can ask questions. Don't feel like you're making them uncomfortable. You probably are. They're probably like, oh, like, we don't have time to explain this, but fine, but who cares? It's your story. So don't feel bad. Talk, advocate for yourself.
Exactly.
Yeah. So thank you so much. Thank you for all the tips that you gave throughout your story for the moms listening, future moms. It's so important. I love getting these stories and getting these little bits of information. Like, you had, 2 beautiful stories, but then you had a little scary situation, and you were probably happy that you were in the hospital for that one. But again, had it happened in the birth center or at home, then you would have gone to the hospital. So I always recommend starting off with a midwife, because like in your second case, you needed the OB to come in, but you didn't lose your midwife, and she still came to your house for those checks after. Like, I've talked about this in one of my other episodes. But if you only have an OB, no one's coming to your house after. You're having to go into the hospital to see a pediatrician or to a clinic. So it's so nice having that continuity of care with a midwife. And you probably saw that, how different that is, right? Having that.
Oh yeah, especially like being so vulnerable, postpartum, right? Like, having someone coming, it's amazing. So yeah, I would have midwife like 300 times.
Yeah, totally. Well, thank you so much, Susan. I really appreciate you taking the time this morning to share your stories with us and all of the tips. And I wish you all the best. I hope you have a lovely day. It's cloudy here in Toronto. It's probably cloudy where you are too.
Yeah, it's a mix of cloud and sun, so it's good. Yeah. Thank you. Thank you. I love that.
Thank you so much. Thank you. Take care.
Bye.
Thank you so much for tuning in to Birth Unboxed. If you've enjoyed today's conversation and want to hear more, please consider subscribing to the podcast so you never miss an episode, and leaving a review. I'd love to hear your thoughts or even your own birth stories, so feel free to connect with me via Instagram at thebirthunboxed.podcast or through my website linked in the show notes. Until next time, friends.